I'm here today with Dr. Adam Braithwaite and Sandy Liles from Novant Health Brunswick Medical Center in the Radiology Department. Welcome to the show today, guys.
Thank you.
I'd like to start with you, Dr. Braithwaite. Tell me a little bit about your education and your role here at the hospital.
So I did my medical training in New York, followed by my radiology residency at Duke University Medical Center, and I did both my diagnostic training there and a fellowship in women's imaging. After that time period, I had an Air Force commitment, so I served 3 years in Northern California with a little stint in Afghanistan, and I was the director of breast imaging for the Air Force at that time, so I helped them set up their digital mammography system, their breast MRI system, and had a wonderful time. After that, Duke recruited me back to their Raleigh hospital, and so I spent a few years out there helping them set up their breast imaging department as well, until a friend of mine called and said, "You want to move out to the beach?"
And of course you said yes.
I said yes, and so here we are. And I've been, I'm the director of mammography of breast imaging here at Novant, and I've had a lot of experience in breast imaging. I love it.
Awesome. How about you, Sandy? Tell me about yourself and how you got here.
Well, I am actually relocated back to the area about 10 weeks ago. I grew up in Cary, and I got my education at the community college in Johnston County, and I worked at Wake Medical in Raleigh Community, and my husband and I went to Florida for 31 years, where I've done mammo and ultrasound, and now I'm a full-time mammographer here at Novant Health Brunswick Medical Center, and I'm happy to be here.
Well, awesome, but I can't believe you moved north. We usually go south.
Right, but it's a good move. It's back home.
That's
so
pretty interesting.
Yes.
Well, today we're going to have a tour of the new 3D mammography unit here at the hospital, and then we're going to see the coach, I understand. So how about let's get started?
Let's do it.
Okay. So it sounds like you guys both have a lot of experience.
Yes, I think so. I've got about 34 years, probably more than Dr.
Just a few more. So this is kind of where it all begins, is that right?
Yes. Yes, this is where we bring the patients in and we interview them, and then they come in and we position them for their exam.
Okay. Well, this kind of looks the same, only a little bit different. I thought it would look totally different.
There's a lot that's the same.
So this is your new 3D unit, is that correct?
Yes, ma'am.
Okay. And is there anything the community members should know about this particular unit?
So the unit itself, probably not, but the technology, what a 3D mammogram is, absolutely. So you could think of a 3D mammogram as compared to a 2D mammogram as you would a plain chest x-ray to a CAT scan. It's that big of a difference.
So like little slices then, kind of like.
Yeah. In the past, a standard mammogram would be 2 images of each breast, and it's just 1 image. With the 3D, the tomosynthesis mammograms, the breast is in compression, so it's exactly the same as the 2D mammogram as far as the procedure, but instead of 1 image being taken, the camera rotates and takes multiple slices. And then those slices are loaded into a computer, and it's a seamless view through the breast. And you can go back and forth and really see the breast in its entirety. This is important because breasts are various densities, and when you have dense breast tissue, when you get that report back from your mammogram saying you have dense breast tissue, it can be difficult to see little masses and things hiding within the dense tissue. So what this does, this new technology, is when we can do those slices and look through the breast, it uncovers those little masses, those little areas of distortion, and so it really, really helps us pick up small cancers that we otherwise might have missed. In fact, the detection of cancer has gone up 40%.
Really?
With 3D mammograms of the invasive cancers, 30% for all cancers.
Wow.
So it's incredible. It's incredible technology. I love it.
So it's much, much more detailed than in the past.
Absolutely.
Much more.
Absolutely.
Sandy, is the experience for the patient pretty much the same as with the 2D unit, with the older units? Will it feel the same, and is it the technique the same?
The technique and the experience for the patient is basically the same. They are still compressed, yes, and that's how you get the best image. That's the most important part of a mammography is the compression.
So it's still a good squish.
It's definitely a good squish.
Well, in general, when should women begin to have mammograms?
So a bit of a controversy, a few years ago with the Joint Task Force, but most people are recommending it still start at 40 years old.
40?
And then have them every year. But I would check with your doctor, ask your doctor, that might change depending on your family history and genetic risk factors. But still think of it as 40 and then every year after that.
And every year after that until when?
Again, that's at the discretion of you and
doctor.
your doctor, and it depends on your family history and just how you're doing, when you're in your 80s or 70s.
Okay, so do we need a physician's referral in order to get the 3D mammogram?
Not for a screening mammogram.
Okay, that's good to know. So we often talk about women having mammograms, and what about men? Is there a reason why a man would need a mammogram?
Absolutely. A lot of gentlemen feel lumps behind their nipples and
Really?
they get breast pain, and absolutely they need to refer to their physician and get that evaluated.
How about you, Dr. Braithwaite? Have you had many instances where you have had to do a mammogram on a gentleman?
Yeah, it happens several times a month. So the incidence of breast cancer in men is so rare that it is not useful to do a screening exam for men. So we wouldn't recommend getting a screening exam every year.
Okay.
But if someone feels a palpable lump, a mass in their breast, by all means, the way to evaluate that would be with a 3D mammogram.
Great. Well, and it being so much more detailed, it's probably better that it's 3D than the 2D.
Helps a lot.
Well, thank you so much for talking to us about this new unit. It looks amazing. I can't wait to try it. But before we go outside to see the mobile unit, is there anything else either of you would like to add?
I would like to add something. So oftentimes in the screening mammograms, people get called back to look at lumps or distortion or asymmetry or something that just catches the doctor's eye when they're looking at these mammograms. With the new 3D mammograms, those callbacks have actually gone down, nationally about 15%. That means less anxiety for the patient, less additional workups, less expense for the patient. So it's a win-win for everybody. I mean, this is the future.
Absolutely. Well, this is a great piece of equipment. Thank you both for showing it to us. And now let's head out to the mobile unit.